Vundi, Caroline Vundi. We are so excited to have you on the show today.
Don't make me blush.
And you look so wonderful.
Thank you.
Yeah, we're
Thank
so excited to have you on the Hey Mama podcast.
Thank you for having me.
Yeah, absolutely. Caroline, we've seen you on Instagram, on so many social media platforms, doing the Lord's work.
Yeah.
You know?
Yeah.
Really supporting and advocating for self-care and
So
all the
affirming.
things.
Thank you for saying that.
Thank you for being a shining light.
Yeah. Thank you. Thank you for saying that. It's funny you say doing the Lord's work. It's actually aligned with my purpose, but we'll talk more about that.
Yeah. So even as we start, Caroline, tell us a little about yourself, your family, and what you do.
All right. So I am Caroline Vundi, Dr. Caroline Vundi. I'm a psychiatrist. I am a mother of one, a 1-year-old, a wife of one. And what can I say about myself? I love women. I love connecting with women. And I like amplifying the stories and the issues that affect women. Aside from that, I'm extremely extroverted and I love to talk. So I'm in my element today. More seriously about the work that I do, I'm a psychiatrist and I currently am focusing on women's psychiatry, women's mental health. And this is because I realized that women go through such unique things in terms of their mental health, leave alone the things that other people go through, such as men, right? Like bipolar or schizophrenia or addiction. We have other things that we go through, like postpartum mood issues. And I feel like we deserve to have special attention given to us. And it's been a journey. I'm enjoying talking about it on my platforms as well.
And we've also enjoyed listening to you and all the insights that you have to offer. Caroline, why psychiatry?
You sound like my mom when I told her I was going to do psychiatry, because she immediately was like, not pediatrics, not, because she was concerned, right? Because I guess there is an image of mental health, and it's very much laden with some stigma. So we think, madare, we think, not what you hope your child will do. So she was very surprised, worried, because I did my training in Madare. Every time she would ask me, are you okay? Are you safe? Should I drop you? I'm like, Mom, I'm fine. And but yeah, to answer your question, why? 2 things. One is because of lived experience, and I'm someone who's had very open conversations about what I've gone through with my mental health. Ever since I was young, I had issues which now I know. Now I know what it is, but then I was a bit confused as a kid, especially as a teen. Even in med school, I wasn't living up to my full potential. I wasn't doing well in school. I distinctly remember sitting in class. If anyone has been to UON, we're like 200. And I remember within the first 15 minutes of class, my mind has digressed. And I remember looking around and everybody's taking notes and they're focusing. And I'm there like, what are you guys? What are we doing, So fast forward now, I know, it was ADHD and I'm on a journey to getting better. And then I go through grief, which completely shatters me. And then I go through heartbreak, which shatters me. So lived experience has shown me that therapy works. Taking care of your mental health is not in vain. So because of that, it awakened me to, what is this world of psychiatry? But also I said 2 things. So the first is lived experience. The second is when I was a GP, I remember that I used to enjoy, when you're a GP, you see everything, colds, flus, tummy ache. But I really started to enjoy talking to people. And I remember my colleagues, you can ask our mutual friend, would be like, you're taking so long. What were you doing? And I'm just there talking to people. Women are telling me about their marriage. And so then I realized, okay, so this is a skill that I can do. And here we are.
Yeah. And we're so glad that you're here.
Me too. Me too.
Yeah. One of the things that you talk about very openly on your podcast, on your platforms, is self-care. You know, we've seen you put out journals on self-care. We've seen you really advocate for it. Why is it so important to you?
It's funny. There's a running joke in my family. People like to say, Karo anajipenda, for my non-Swahili speaking people. Like, Caroline loves herself. And for the longest time, even as a kid, I'm telling you, I chased self-care. I would chase these things because really I was drowning. So for me, self-care is like a parachute, because it's either that or we are hitting the ocean and we are drowning, you know. So that's how I look at self-care. And for me, it's not about it being expensive. It's not about a spa. You know, how it's been packaged on social media nowadays is very much elitist, that only certain people can access it. But I'm telling you, self-care is for everyone, even for kids, for your kids. You can teach them how to take care of their minds, to take care of their hearts, to take care of other people's hearts, to be gentle. So for me, that's actually my personal mantra. I love to sleep. I love to take naps. I love to listen to my body. If I'm tired, I'm not leaving the house, you know. So that's what really, I think it's important to perform such acts of self-care so that you don't drown. Yeah.
I love that.
Yeah.
One of the other things that we've seen on your platforms is how you've bloomed into motherhood.
I'll take that.
And I love how you swoon about it.
Yeah.
And tell us about your motherhood journey and your experience being a first-time mom.
Yeah. Wow. Do we have time?
We have lots of time.
It's been a roller coaster, a lot of ups and some downs. So motherhood, of course, starts with pregnancy. And for me, there are things I enjoyed about pregnancy and there are things that were really tough. The first thing that took a hit was my mental health. And this is because I had a previous experience. So for anyone who's had anything in the past that's affected your mental health, I need you to know that when you're pregnant, things can come up again. So if you experience some sort of depression or anxiety, it's possible for it to resurface, and that happened to me. So I quickly got into therapy, and I realized in motherhood, a lot of things will come up. And I didn't know, even your issues with your mother will come up. Your issues with your father will come up. Even with your marriage, things will come up, right? And so I quickly started, I went back into therapy and I quickly got into self-care. But it was tough. I won't sit here and act like it was, maybe I showed a really nice side of it, but there are times it was tough. What did I love? I loved how I was glowing. I was glowing, my hair was glowing, my skin. I think I looked good, but internally there was a storm. Fast forward, when my son came, I was lucky enough to be one of those people who instantly connected with him. There are women who don't, and that's okay, and I guess we'll talk about that more. But postpartum was rough. Postpartum was really rough. Where are we now with motherhood? I think that something beautiful has really happened. Matrescence, when a mother is born, a version of me that I always knew I had potential to be has suddenly bloomed, I'll use your word. A part that's really so confident, a part that is very clear about who I want in my life, what I want to do with my life. It's sharpened me. Motherhood has really sharpened me. And I'm grateful.
Yeah. Tell us about your son.
Oh my
And I love
gosh.
how you just glow when we ask about him.
Yeah.
Tell us about his personality, what you like about him.
I'm so blessed. Let me tell you, God really gave me a wonderful child. So interestingly, I prayed for a child who sleeps. Remember how I told you that for me, sleeping is so important? And, I told God, me, God. You know me. I love to sleep. So, he started sleeping through the night at 3 months. Yeah.
What?
In fact, sometimes we would have to wake him up because, we were like, are you hungry? Like, do you perhaps want to wake up? He's so pleasant. I feel like he got the best of me and my husband. He's such a nice blend in terms of like the traits. He's so happy and he's so gentle. He's so curious. He's chatty like me, but also he's just peaceful. He has a peaceful spirit. There's one of our friends told me that he has like mature, like his eyes are like mature, like he has some wisdom in him, and I see that a lot in my husband. I could go on and on.
Yeah. I absolutely love it.
Yeah.
I love when women talk about their children and they just glow. It's so beautiful to see. Tell us how, being a new mom, affected how you showed up for your career and all the other responsibilities that you had, being a wife and all that. Yeah.
Oh, that's a wonderful question. And it's, I'll take you back to postpartum pregnancy. So when I was in my 3rd trimester, I got a lot of postpartum anxiety. Again, I had dealt with anxiety for a long time, rather. And anxiety for me was because my pregnancy also had some scares here and there. So I was always anxious, like, is something going to happen? And then also in the work that I do, it was overwhelming to emotionally carry some stuff from my patients. So we had a conversation with my doctor, and I remember she just asked me, what's more important right now? Is it your baby and your life or your job? And immediately it was the answer was easy, and it's my baby, my life. And that led to us deciding for me to take my 3rd trimester off. So I wasn't working in my 3rd trimester. And, I'm lucky that my boss at the time was a good employer, but I had reached a point where either way, even if I was ready to lose my job, just to be in a place where mentally I am okay in my 3rd trimester. I'm not going to work every day stressed. Because what happens is, and maybe I'll get a bit medical, in pregnancy, the placenta protects the baby from cortisol, and cortisol is the fight or flight chemical in your body. So basically, your placenta protects your baby from anxiety and stress. But if the stress is too much, if it goes beyond a certain level, it can eventually, maternal cortisol can cross over. And then now your baby is stressed. And then remember that we tend not to medicate a lot in pregnancy unless really it's needed. So if a baby is exposed to a lot of cortisol, a lot of stress, this puts them at risk of developing mood disorders later on in life, or even being very hyper and agitated and having other mood issues as a toddler. So for me, I know it's, a woman might be watching this and thinking, but I need my job. I'm not saying it's easy to decide between your job and your child, but sometimes it's not about ease. It's about what do you want your mental experience to be like, and even for your child, right? So I get the 3rd trimester off. I'm home, and baby comes. I still have a lot of anxiety, and at the point where my son was 5 months old when I decided to now do something about it and to see a psychiatrist. And because before I had just been seeing a therapist. So I was put on medication because I was depressed and anxious. And it wasn't easy. One would think that because I'm a psychiatrist, it was easy, but it was not. I felt like a failure. I felt like, because I was still breastfeeding, I felt like, what will this medication do to my child? And I say all this to say that the moment I took the medication and I felt okay, I became a better mom. I became better at my job because now I went back to work. I became less moody at work. I became a better wife. And so your mood in the postpartum or peripartum period is really directly related to how you show up at work. When I got on medication, even patients noticed. They would say, oh, you're looking better. We didn't want to say anything, but, you kind of used to look a bit, low, or you are not okay. Can you imagine your own psychiatrist,
Wow.
you're a psychiatrist and your patients are telling you, we were worried about you. So, but yeah, afterwards, I realized that being a mother also changed my career a lot. Some of the decisions that I made in terms of my working hours, it had to change. I couldn't live a life where I wake up in the morning, I see my child for 30 minutes, I run out of the door, I'm at work all day, come back home at 6 when he's sleeping, Monday to Friday. So that, of course, led me to part ways with being an employee and working for a hospital setup, and now just working for myself. So it's changed me a lot. I love my job, but I don't love it more than being a mom.
Yeah, that is so beautiful. Just looking back to the insights that you've shared about your postpartum experience, a lot of people would not have information to know that they're unwell like you did, to know that there was something wrong.
Yeah.
And we find a lot of times information about the postpartum period is lacking. Why do you think that's so, particularly when it relates to mental health?
Yeah. I think it's a question of priority, and I won't blame gynecologists or pediatricians, right? But everything during pregnancy and postpartum, the most important thing is, you giving birth and having a healthy pregnancy. And we worry about blood pressure and the weight of the baby and will he make it to 38 weeks. So those things are like, how we've got traffic lights? They're like red. So they are important and they kind of take the front seat such that by the time your gyna is asking you, how are you? Are you sleeping? It rarely happens. It actually, for me, I was lucky it happened because I would also bring the conversation forward to my gyna. I told her I've had issues with depression, with anxiety, and so I would also bring it up. So I don't know if our priorities are off as doctors. Maybe it should go into our training. But did you know that the guidelines recommend that a woman is screened for postpartum or peripartum depression at least 4 times?
What?
Yeah, during pregnancy and postpartum. Twice in pregnancy and twice in postpartum, using a standardized screening tool. So not just the history part, 4 times.
I had
How many times were you checked?
Yeah.
And so that's why I went back to do this course, because I kind of want to get it right and spread the knowledge, because this information needs to be known by GPs, by gynas, and by pediatricians. I remember one time in my postpartum period when I was starting to struggle, I remember sitting across from my pediatrician and she was just asking me questions about breastfeeding. And I remember feeling like I wanted to scream. And I'm just there talking. I'm talking like the way I'm talking right now. And I'm saying, oh, yeah, he's breastfeeding, he's latching. But internally, I wanted to scream. And I didn't have anybody to tell that to. So, and we went home. And much, much later, that's when I told my husband, I don't think I'm okay. I need to talk to somebody. But now, can you imagine? I know this because I'm a psychiatrist. How many women don't know who to go to? So I guess that's why I'll never stop yapping about this. I'll never stop making noise, just so that women can know that please talk to somebody. Please tell your gyna, your pediatrician, your husband, your friend who comes to visit you, tell her I'm not okay.
Yeah. I absolutely love that, because one of the things that you've alluded to is something we call self-advocacy. So fighting for yourself, even while you're within the healthcare space. Being able to, one, know that there's something wrong. I think that's the first thing. And that's why we're having this podcast. That's why we're having experts like you. So one, being able to realize that maybe something may be off. And then being able to fight for yourself while in the doctor's office. Because sometimes you find that, doctors may not always ask all the questions, and being able to say, no, I need to remind the doctor to ask.
To ask about this.
Yeah,
I love that. About self-advocacy and knowing you're not okay. Some women don't know what that okay is, because conversations on pregnancy and motherhood sometimes don't talk about the mental part of it. And that's why at the beginning I said that some women, when the baby comes, they don't have that, wow, such a cute baby, my son or my daughter. Some of them feel like, what's going on? Who is this? Am I expected to take care of, am I supposed to go home with this baby? I'm supposed to love this person I just met. So within the first couple of days, up to even day 5, women go through something called baby blues. And really, I want women to know that it is normal to be moody, to be tearful, to not feel a connection to the child or to your husband. It's okay to have postpartum rage, just to have an anger that fills you so quickly. Within the first week, that's fine. It's called baby blues. And I want you to know that a lot of women feel it. Actually, up to 90% of women get baby blues. So that's okay. But if you start feeling the sadness and the irritability persisting and the lack of sleep persisting months after giving birth, right? We are talking even up to 6 months of giving, 6 weeks to 6 months of giving birth. Now we are entering the territory of postpartum depression. So please speak up, because that tends to be a bit more serious and needs to be addressed. Beyond that, we have other issues like postpartum anxiety, which affects 60% of moms in the postpartum season.
Wow.
Where you're always fearful. You're fearful of your baby. When you go and you try and keep checking whether they're breathing, you're always anxious. You're always worried. You can't sleep. Your heart is always racing. Speak up. You'll be surprised to know that there are so many natural, Ayurvedic, homeopathic remedies for postpartum anxieties. And one that really worked for me in the postpartum season was ashwagandha. Yes, I started taking it in the postpartum season. Magnesium, I've talked about it. So speak up. And I think a lot of women don't speak because they're scared of being put on an antidepressant or an anti-anxiety. And I'm here to say that just have the conversation with your doctor, with your psychiatrist, and then don't be afraid of whatever the remedy is.
Now we're starting to learn about how our menstrual cycle can affect our mood, and how that can also trickle into how we show up in our motherhood. Could you talk to us about the menstrual cycle and how that can affect how we show up?
Right. It's my new passion project to educate women on, I call them menstrual moods. So how your menstrual cycle affects your mood. I've recently been talking about it using the 4 seasons of the weather. So winter, spring, summer, and fall. So every woman goes through such, right? With winter being, because winter, snow is falling. So I call that I liken it to the menstruation phase when you're having your menses. And it tends to be dark, cold, moody. So that's how we tend to feel when we're menstruating. Then we have spring, which is the follicular phase. A lot of women will relate to when your period ends, it's like a switch has gone off. Everybody now is pleasant, yes. Whereas before you didn't even want to see your husband. I'll admit to that one. So spring, your mood is better. Even libido goes up. And that's because your estrogen and progesterone are rising up again because they had fallen during your menstrual phase. So after spring, we see summer. Summer is hot. We are ovulating. And nature is so interesting because ovulation is designed to get you pregnant. So that is when now your husband is so attractive. Yeah? I like to tell women, are you in love or are you ovulating? But similarly, even your mood tends to be, you're more social. You want to interact with people a bit more. But you can also be a bit hot-headed. Sometimes with ovulation, you can be a bit feisty. So lastly, then we've got fall or autumn, and that's the luteal phase. Luteal phase is a bit moody, right? That's progesterone is what dominates during your luteal phase, and women tend to be moody, confrontational. They don't want to see people. A lot of women, by the way, who have very severe issues during the luteal phase will tend to be diagnosed as bipolar. Because, you're just erratic. So why am I talking about these 4 seasons and the menstrual moods? It's because it's so important to, when you're having mental issues, whether it's depression or anxiety or you can't sleep, I think every therapist or psychiatrist should ask when these issues occur. Do they occur during your cycle or is it throughout? Because I've seen a lot of women being diagnosed as bipolar, but you're having PMDD, which is premenstrual dysphoric disorder. Basically, your moods are just haywire because of your menses. So it's important for you to know as the woman so that you manage your energy, right? Know when to do certain things. I've been talking about, for me personally, I don't do certain things during my luteal phase. That's not the time I will, for example, have a shoot, because I will be mad at everyone and my energy will be off. So you as the woman, get to know your cycle so that you manage yourself. You manage when to do stuff. But also for doctors, know these things so that we don't skip these things. We don't miss them and place a wrong diagnosis on a woman.
Yeah, I love that. And the other thing that's becoming a lot more common, and we're hearing a lot about it, is tracking your menstrual cycle so that you know where you are. And I love what you've mentioned about the seasons. So do you think it's important for women to know which season they're in?
Yes. So there's something called cycle syncing. And cycle syncing is practicing self-care that's targeted to the part of the cycle you're in. So, for instance, when you're in the follicular phase, what self-care will work during that phase? We've said your follicular phase, you're springing. That's a time, sure, go to the gym, like be out there, right? But luteal phase, it'll be unfair for me to expect you to do the same workout during your luteal phase as you usually do during your follicular phase. It would be unfair for me to, for instance, expect you as my wife, right? If I'm a man, to have the same libido during the luteal phase as the ovulation phase. So for a woman, it's important for you to know so that you practice self-care differently. I've also been talking about seed cycling. So as a woman, there's some seeds you can use during the different phases to help balance out your moods and your hormones. So for the first 2 phases, during the follicular phase and ovulation, you can use flax seeds and pumpkin seeds. You can blend them up and then pour them into whether it's your oat milk or whatever you're eating. And there's even a specific diet for that season. But then now during luteal and the menstrual phase, we are using now more of the sunflower and sesame seeds. So it's important to know so that you practice self-care differently, self-care that is targeted, self-care that works.
And you talked about seed cycling. Tell us a little more, because I'm sure someone watching this is wondering, okay, so if I add these seeds into my food,
what's happening?
Yeah, what happens?
So the thing is, so I'm a big natural medicine enthusiast, because I think nature has so many healing properties, right? So there are some seeds that have been studied that are when you consume them, they help balance out your hormones, because sometimes the drastic shifts in your hormones is what's causing these mood issues. For instance, when you're menstruating, estrogen and progesterone are just dropping very drastically and quickly. So what the seeds do, they help regulate the hormones in a very easy way. Instead of them dropping quickly like this, they're just dropping slowly like that. So that's what they do. So I would think that a lot of times we are very quick as psychiatrists to pass you a pill. By the way, it's fine. I also give prescriptions, but can you imagine how much better it is to tell a woman things she can consume that can help her experience long term? I think that's a better approach. It's more sustainable. So that's why I'm so passionate about the seed cycling.
Yeah, it's interesting because one of our other guests, the menstrual doctor, Dr. Caroline Aleng, also mentioned that there needs to be a shift in the way that we practice medicine, particularly in our context.
100%.
We need to shift from just prescriptive medicine, and also move to holistic medicine, where we're looking at natural ways, exercise, balancing all those things, of course, providing medication when it's necessary,
100%, yes.
but also not forgetting or neglecting the natural ways of helping
Exactly.
someone's mental health.
Exactly, because even diet comes into play during seed cycling and nutrition, right? Because usually when you're in your luteal phase or in your menstrual phase, have you ever noticed, maybe it's just me, but I eat so much during my luteal phase and my menstrual phase, when I'm menstruating, I can eat like mtu wa mjengo. No offense to watu wa mjengo, but like I will eat because your body is telling you something. Your body will want more carbs during that time. Your body will want more legumes during that time, less sugar, less caffeine during that time. So, I mean, it's if we don't give out this information and we just hand you a pill for your PMDD or your PMS, we're not really helping you.
Yeah, I love that. Just to take you back a little, you talked about, these hormonal shifts. What would you say to a mom who's not sure what's happening with her body? How can she tell when her hormonal shifts are now starting to affect her mental health? Because sometimes it can be blurry for someone to have something we call insight or having the ability to know that you're unwell. So what signs can they look out for?
Okay, so the signs are like category A and B. So category A signs are more mental. So sadness, anxiety, irritability, everything is almost sending you over the edge sort of thing. And even suicidal thoughts. But category B symptoms are hormonal symptoms, things such as bloating. There's something called a menstrual migraine, that when you're on your period, you get this terrible headache, either on the first day or the third day. So menstrual migraines, sometimes hormonal acne, sometimes having issues with your weight. So if you're having these things happening together, I would recommend you have a conversation with a therapist, psychiatrist, or gynecologist. Also, if your period is very heavy, very prolonged, irregular, that's also something that I would flag. But I would also like to say that as a woman, just track how you feel during your period. Start from there. I know maybe tracking the whole cycle might be difficult for starters. Just start by writing down how are you feeling when you're on your period. That'll tell you a lot. If you're on your period, you're extremely sad, you're extremely anxious, you don't want to see anybody, I'll flag that one a little bit. So if any of these are making sense, it could be a menstrual mood issue. But also, if you've had any issues postpartum, any issues with your postpartum mood, or if in pregnancy you had mood issues, that could also be a hormonal issue. Because you know what happens in pregnancy? We have a rise in estrogen and progesterone so that they support the pregnancy. So if you developed depression and anxiety when you are pregnant, what might that mean? Yeah. There could be an issue with how you tolerate hormonal shifts. So any woman who's had any issues when she's pregnant, please, 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 this is a time to get access to a good therapist or psychiatrist, because guess what? Later on in life, if you have another baby or if you have menopause, that's another hormonal shift. You might have issues later.
Yeah. And that's a good segue into my next question, because, I'm just wondering, how can we better communicate with healthcare workers so that they believe us? Because a lot of the times, some of these signs and symptoms are called, quote unquote, malingering. So how can women advocate for themselves?
First of all, I think women, gaslight themselves so much. You think you're being dramatic. You think you're imagining this. So I'll just first tell you to believe yourself. Because when you believe yourself, you'll advocate for yourself in such a way that you'll even surprise yourself. I remember going into the office and telling the doctor, this is what I think I have. And I had been researching and reading about it because I believed myself. So it starts with you believing yourself. Because if you don't, the doctor sitting across from you will take you on a whole other journey of gaslighting you. But I think the other thing is for us to have a multidisciplinary approach when we're managing women. So a woman is not owned by the gynecologist alone. A woman in the postpartum season is owned by a team. Your gyna, the ped, a therapist, a lactation. All those people need to be around the woman, so that if you as the woman are trying maybe to talk to your gyna and they're not listening, you're trying to talk to your ped, they're not listening, talk to your lactation specialist. Maybe they'll have a way to even reach out to your gyna and say, okay, this is what's happening. So for me, in my ideal world, this team works together. But what happens in the real world, your gyna is even almost offended if I give him a call to talk about you. So something needs to change systemically in how we manage women in the peripartum period. I would love it if we had if a woman is coming in for her postpartum check, you're sitting there with the gyna, the lactation specialist is there, and I'm in the room as well as your mental health doctor. How ideal would that be? So advocacy, self-advocacy, and what we are doing today, maybe one day we'll get there.
Yeah. I love that. And I feel so sad that we have to almost end this podcast. But let me ask this question. This Caroline, there's probably someone who's watching. She's a first-time mom. She's just feeling like her world is about to end. She's had sleepless nights. She's struggling with anxiety. She has so many challenges with breastfeeding. What encouragement would you give first-time moms who are navigating this new territory?
I'll say that there is nothing wrong with you. You're not weak. You're not a weak mother. You're in very good company. Me as a doctor, I went through it. I went through breastfeeding challenges, everything, postpartum anxiety, postpartum depression. I've mentioned I was on medication. So you are in good company, 1. 2, it gets better. It does. Time really goes by quickly in the postpartum period. But for it to get better, you have to get help. So you're drowning. You have to speak up. You have to say that you need to talk to somebody. You can't be drowning in silence. So talk to somebody, tell your friend, tell your mother-in-law that mentally I need help. So it gets better, but only if you do something about it.
Yeah. I love that. And maybe if you can, are you able to share examples of what self-care looks like so that this mom who you've just spoken to can have nuggets on what to do?
Okay. So self-care starts with making decisions to get help around the house. So it'll be simple things like just getting a good nanny, getting a really good nanny, and letting the nanny be the nanny. Because sometimes in postpartum, you have a good nanny, but you won't let her change a diaper. You won't let her give the bottle. You want to, because of that anxiety, I guess, right? So allow people in. Pick up the phone and tell people, come and see me. I remember I struggled with that, with actually telling my friends and family that today is one of those days where I need someone to come. Pick up the phone, because unfortunately, after you give birth, people's lives go on. People kind of forget. After the first month, they move on. But get that phone, tell people, come. And then number 3, get out of the house and take a walk. Leave the baby, get out into the sun. It doesn't have to be like a 30-minute walk. Just, you need a bit of space from the baby, especially in the postpartum season. Even if it's 5-10 minutes, just get out and get some sun.
Yeah, I love that. We have been so privileged to have you on this podcast. Thank you so much for the work that you do, advocating for women's mental health. It's been such a joy to watch you on social media, and we can't wait to have you again.
Thank you. Thank you so much. If anybody is watching and they would love to reach me, I'll share all that I need to share. And I hope I'll be back to talk more about motherhood.
Thank you. Thank you, Caroline.
Yeah, thank you.